I thank the chair. This markup this morning does include some important work, and I'm thankful that we'll continue to move it through the Energy and Commerce Committee. An important bill, H.R. 5534, the Comprehensive Immunosuppressive Drug Coverage for Kidney Transplant Patients Act of 2019, is something that I've been working on for nearly a decade. In 1972, Congress enacted legislation to allow certain individuals with end-stage renal disease to enroll in Medicare. This was the first time an individual under the age of 65 would be eligible to enroll in Medicare due to a specific medical diagnosis. Medicare beneficiaries with end-stage renal disease only make up about 1% of total Medicare enrollment, but they account for 7% of Medicare fee-for-service spending. These patients can be incredibly ill and oftentimes have several other costly other chronic medical conditions. A kidney transplant is an investment. It's an investment that the government makes into that patient's future. Medicare pays for the patient's kidney transplant if they have the end-stage renal disease benefit, and that transplant should be a solid investment in the future health of that patient. Unfortunately, the investment is lost, and the patient's health is jeopardized if they cannot get their immunosuppressive drugs and reject their kidney transplant. So we should protect that investment. Currently, Medicare only covers immunosuppressive drugs for 36 months. However, these patients require these drugs for the rest of their lives. H.R. 5534 directly addresses that problem by extending Medicare coverage of immunosuppressive drugs past the 36-month limit for patients who do not obtain health care coverage elsewhere. This is a policy that has significant support from everyone from patients to the transplant surgeons, and it is something that the kidney community has coalesced behind for several years. Last July, I attended the launch of President Trump's Advancing American Kidney Health Initiative, which aims to improve care, foster innovation to benefit kidney patients across the country. So this policy, H.R. 5534, aligns with the goals of the administration. In fact, both the Center for Medicare and Medicaid Services and the Office of the Actuary and the Office of the Assistant Secretary for Planning and Evaluation at Health and Human Services have published reports on the benefits of extending Medicare coverage of immunosuppressive drugs, which include financial savings for the Medicare program. So this is the time to make a difference in the lives of kidney patients. H.R. 5534 will deliver those marked improvements in the lives of patients with end-stage renal disease, and of course, it positively affects their families as well. So I really want to see this move through the Energy and Commerce Committee and the next step toward becoming law. We do have other bills before us today, and to help provide American patients with the care that they need, Representative Carter, H.R. 3935, would continue the requirement that state Medicaid programs provide coverage of non-emergency transportation for medically necessary services. Important bills that will help families and children, such as 2271, the Scarlet Sunshine on Sudden Unexpected Death Act, and H.R. 2468, the School-Based Allergies and Asthma Management Program Act, and H.R. 4801, the Healthy Start Reauthorization Act of 2019. Other bills will help deliver safe and effective pharmaceuticals and medical devices to Americans, such as Representative Guthrie's H.R. 5663, the Safeguarding Therapeutics Act, and H.R. 4712, the Fairness and Orphan Drug Exclusivity Act, and 4866, the National Centers of Excellence in Continuous Pharmaceutical Manufacturing Act of 2019, and that has grown in importance since the non-availability of active pharmaceuticals from mainland China because of the effects of major illness over there. So this bill is timely and is one that this committee would do well to advance to the full committee. Our supply chain and pharmaceutical manufacturing, and in fact medical devices, all need to be available and safe. So these pieces of legislation are important to public health protection by allowing the Secretary to destroy certain counterfeit medical devices, protect orphan drugs, and improve continuous manufacturing capabilities. In the midst of discussions about ensuring a robust and insurance healthcare workforce in the wake of coronavirus, it is disappointing that we are not including a bill that I introduced with Chairwoman Eshoo, H.R. 4870, the United States Public Health Service Modernization Act. This bill would provide retirement benefits, rights, and privileges to our hardworking and necessary Ready Reserve Corps. So I thank the chairman for holding this markup today. I hope we can move on the IR bill because I do think it is important at our next markup, and I'll yield back my time.